Hello, and thank you for joining me for this Medicare Workshop video. My name is John Durbus. I'm a licensed agent and Medicare expert here at Blue Cross Blue Shield of Minnesota in Duluth. In this video, you'll learn how and when to enroll in Original Medicare, what Medicare does and does not cover, and most importantly, how to pick a plan that best fits your health and lifestyle needs. The video lasts about 1 hour long. And by the end of it, you'll have a great foundational knowledge of Medicare. After the video, most people choose to work with a trusted person to help guide them through the Medicare process. And that's great. That's what my colleagues and I at the Blue Cross Center in Duluth do every day. We offer free one-on-one consultations to answer all your questions and recommend a plan that best fits your lifestyle. When you're ready to enroll, we simply complete your enrollment form and we continue to be an ongoing resource for you into the future. If you ever have any questions, you simply need to reach out. I hope you enjoy the video.
All right, well, let's start by looking at the topics that we're going to be covering here today. And this is really going to be split into two different parts. So we're going to start in the first part by covering Medicare basics. And here we're going to be talking about Part A, that covers you when you're in the hospital, and Part B is in Bravo. That's going to cover everything you do outside the hospital. Now, Part A and Part B together are commonly referred to as Original Medicare. And I want you to think of that as the base coverage. That's what everyone starts out with. And then in the second part of the presentation, we're going to go on and talk about the plans Blue Cross Blue Shield offers that supplement, that give you more coverage than what you're getting from that base Part A and Part B. And we'll also talk about why you might want to add more supplemental coverage. And then we'll go ahead and identify some key criteria for you to take into consideration when choosing which one of the supplemental plans is going to be most suitable for your particular needs. Well, let's start with the timing. So this is going to be when you're eligible for Medicare and when your coverage will actually take effect. Now, the most common way to qualify for Medicare is simply turning age 65. So those of you listening today that will be new to Medicare because you will be 65, the initial enrollment period is going to be important. Now, this period is going to include the month you turn 65, the 3 months before, and the 3 months after. So it is a 7-month window. Now, if you're collecting Social Security benefits for at least 4 months prior to turning age 65, then you will automatically be enrolled in both Part A and Part B Medicare. You'll get this red, white, and blue Medicare card in the mail around 3 to 4 months before you turn 65. Now, if you're not collecting those Social Security benefits, that's okay. You're still eligible for Medicare when you turn 65, but in that case, you are going to need to initiate turning those Part A and Part B benefits on. And you're going to do that by contacting the Social Security office. You're either going to call them or you can enroll on their website. And I'll have both the phone number and the web address on the next slide. Now, when you are eligible to contact Social Security, well, again, that's going to be during that 7-month initial enrollment period window. And as long as you're reaching out to Social Security during those first 3 months before you turn 65, then the effective date for both your Part A and Part B Medicare coverage will be the first of the month in which you turn 65. Now, if you wait to contact Social Security during your birth month or those 3 months that follow, that's okay. You're still in that initial enrollment period window. However, now the effective date for your coverage is going to get pushed out a little bit further. The next enrollment period we have is the special enrollment period. And there's a number of different events that may occur in your life that will open up a window of opportunity for you to either sign up for Medicare for the first time or in some cases make changes to that extra supplemental coverage that you've added on top of your Medicare benefits. Now, we won't have time here today to go into detail on all the different special enrollment events, but I will talk a little further about the most common special enrollment event that I see. And that would be people who turn age 65. So they are eligible for Medicare. However, they're working and they have a plan that their employer is offering and they want to stay on that plan. Well, you can do that as long as the employer coverage is what's called creditable. Now, creditable coverage just means as good or better than Medicare's coverage. And to find out if your employer is indeed offering creditable coverage, you can talk to someone in your HR department or whoever handles benefit administration at your company. Now, again, as long as it's creditable, you can stay working and stay on that employer coverage as long as you want. When you do finally decide to retire, that is going to create the special enrollment event. Now you can contact Social Security, let them know you're coming off of a creditable employer plan and you're ready to start Medicare. Well, two other enrollment periods to go through on this slide. First, to the bottom left, we have what's called the annual election period. And this is always going to occur every year between October 15th and December 7th. And this is the time when all Medicare beneficiaries are going to be reviewing their needs. And if they want to choose a different supplemental plan, they can do so during this period. Now, any plan you elect between October 15th and December 7th will then take effect January 1st of the following year. And then finally, over to the right, we have what's called the open enrollment period. Now, first of all, this period will only apply to those Medicare beneficiaries who have elected what's called an Advantage plan. Now, an Advantage plan is just a type of plan insurance companies offer that gives you more coverage than what you're getting from that original Part A and Part B Medicare. And we'll talk in more detail about Advantage plans in a little bit. But for now, just know if you did elect an Advantage plan, and then during the first 3 months of the year, you decide that plan isn't suiting your needs, or maybe your needs have changed, well, you actually get an opportunity to drop that plan and pick up something else. So think about this as a trial period if you choose an Advantage plan. All right, well, as promised on the next slide, I do have the phone number for Social Security and their website over to the right. And I've also included some helpful resources here with the Medicare helpline and the senior linkage line. Well, let's now look at the benefits that Medicare is offering. And these are, again, your original Medicare benefits. And we'll start over to the left with Part A. Now, Part A Medicare is primarily going to be covering you while you're in the hospital. Most Medicare beneficiaries do not have a monthly premium cost for Part A. They get it at what's called premium free. However, if you do start utilizing this benefit, there will be some costs. Now, let's take a look at that. Medicare is going to break this Part A inpatient hospital benefit into 3 different periods. The first period is going to cover the first 60 days that you're in the hospital. For those 60 days, you're going to have a $1,484 deductible. So you're going to be responsible for paying the first $1,400. After you meet that deductible, then Medicare is going to step in and they're going to pay 100% of all covered benefit costs for that 60-day window. Now, if you have a little more extended stay in the hospital, the next period gives you 30 more days of coverage. Those would be days 61 through 90. Now, for those days, you have a $371 daily copay. And the next period is going to give you 60 more days of coverage, days 91 through 150. And now that daily copay doubles from what it was during the last period. So you would be responsible for paying $742 every day. Now, you'll notice in parentheses under those last period days, days 91 through 150, it says lifetime reserve days. And that means just like what it sounds like. You only get to use those days one time in your life. Once you use them, they are gone. So I want you to think of your Part A benefit as 90 days of inpatient hospital coverage per benefit period. All right, and a benefit period is going to start the day you go into the hospital, and it's going to end 60 consecutive days after you're out of the hospital. So let's look at a couple examples to help illustrate this. Let's say you go into the hospital for 2 nights, and then you go home, and 30 days, let's say, after you're home, you need to go right back in the hospital. And it could be completely unrelated to why you were there the first time. Well, in that case, you haven't been out of the hospital those 60 consecutive days, so when you go back in the second time, you're actually in the same benefit period, which means now you're going to be on day 3. So those days keep accumulating. Now let's look at another example. We'll start the same way, the same 2-night stay in the hospital, Only this time after you go home, it's not until 61 days that you've been home that you need to go back to the hospital. Well, that is going to generate a whole new benefit period. So in this example, when you go back in the second time, you're back to day one. You're also going to go back to having to meet that $1,484 deductible again. So you might have to meet that deductible multiple times in the same year, depending on how frequently you're in and out of the hospital. All right, well, let's go over to the right and talk about Part B Medicare. Now, Part B is going to cover everything you do outside of the hospital. So quite a few things covered by Part B. For example, office visits, whether to a primary care physician or to a specialist. This could be trips to the emergency room or urgent care. It could be an ambulance ride, durable medical equipment like canes, walkers, CPAP machines. This could be diagnostic tests such as x-rays, MRIs, CT scans. So again, a lot of different things covered under the Part B benefit. Now here, unlike Part A, where most people get it premium free, Part B, there is going to be a monthly cost. And it starts this year at $148.50 a month. Now it can go up to just over $504 a month. So pretty big range there of what you might be paying for that Part B benefit. Now Medicare is ultimately going to determine what you pay for your Part B based on your income. And quite simply, the more money you make, the more you're going to pay for Part B. Now they have set income threshold levels. So if you are single and your income exceeds $88,000, you're going to pay more than that $148.50. Married couples filing taxes jointly with an income that exceeds $176,000 are also going to have to pay more than that $148.50, and just how much more depends on how high your income goes above those threshold numbers I just gave you. Now there's also a deductible for your Part B services. This is relatively low, it's $203. So you're going to pay the first $203 for any covered Part B benefit cost. After you do, it becomes an 80-20 plan. That means Medicare is going to pay 80% of the cost, and you're going to be left paying the remaining 20%. So that is how your original Medicare benefits are going to work. Now, just as important as it is to understand what Medicare does cover, it's really important you understand what Medicare does not cover. So we'll start with the first bullet point, inpatient hospital days beyond Medicare's limits. Well, we know now that you get 90 days of inpatient hospital coverage per benefit period. And then you also get those 60 lifetime reserve days to use if you need them. But if you exceed that, there is no coverage with original Medicare. Routine physicals. So Medicare is going to give you 12 months from whenever your Part B is in Bravo Medicare starts to go get a Welcome to Medicare exam. And this one is a pretty thorough annual exam. However, they only give you that thorough exam one time. So every year after the first year you're on Medicare, you get what's called a wellness visit or a wellness check. And this one is pretty limited in scope. It's not going to cover much more than your height, your weight, and your blood pressure. Now, Medicare will step in and cover some bigger ticket kind of testing items like mammograms, colonoscopies, bone density tests, a lot of cancer screenings, but that actual office visit to go in and see your doctor is going to be limited to the wellness visit. Some other preventive services Medicare will not cover: a routine hearing exam, a vision exam, and most of your dental care. Medicare is also set up to cover you in the U.S. only. So for the most part, if you travel outside the U.S. and just have original Medicare, you will have no coverage. And finally, we talk about prescription drugs not covered by Part A or Part B Medicare. Well, let's start by talking about what is covered medication-wise by Part A and Part B. When you are in the hospital, any medication administered to you is going to be covered by Part A. Part B is in Bravo medications. Medicare is going to decide what a Part B drug is. Now, most of those medications covered under Part B, those are going to be infused drugs. So you have to go into a clinic or a hospital in some cases to have them administered to you. Most common example of a Part B is in Bravo drug is going to be chemo. Now, the last thing I want to mention here about original Medicare is going to be up at the top in that green box, just to the right of the $sign. And that's where it says original Medicare does not have an annual out-of-pocket max. And that means if you exceed the number of inpatient hospital days Medicare covers, you're on your own and there is no limit to what you're going to be paying. With the services you're getting outside the hospital, covered under Part B, we know now that you're paying roughly 20% of the cost for those services. But the big question here would be 20% of what cost? Now, visits to a primary care physician might not be too expensive, but you start seeing some specialists. Maybe you take an ambulance ride, emergency care, some of your diagnostic tests like MRIs, CT scans, even your lab work. That kind of stuff can get very expensive, paying 20% of which that can still be a very high number. And this is without a doubt the number one reason why people will come to me to get supplemental coverage, so that they can get that out of max in place, so that they can kind of have that worst case scenario. Now, all the plans we're going to look at next that Blue Cross offers are going to do just that. They're going to give you that out-of-pocket max. Well, before we get into the specifics of the Blue Cross Blue Shield plans, I just want to show you the different types of supplemental plans that are available. The first two listed, the cost plans and the advantage plans, these are going to be regional. That means the county you live in is going to determine which one of these plans you're actually eligible to enroll in. The next two, the Medicare Supplement, or what are often called Medigap plans, and finally the prescription drug plans, those plans are going to be available statewide. And as we progress through the presentation, I'll go into far more detail about how each of these plans works. A little bit of background about Blue Cross Blue Shield. We have been in Minnesota for over 85 years. That does make us the longest running health insurance company in Minnesota. We've been serving Minnesotans for over 4 generations and currently have well over 300,000 Medicare members. Now, that number represents over half of all eligible Medicare beneficiaries in the state. We're very proud year to year to have highly rated Medicare plans, and we are very committed to giving back to our local communities and charitable organizations. All right, well, the first plans we'll be discussing today will be our cost plans. And at Blue Cross Blue Shield, we call our cost plans Platinum Blue. Now, these Platinum Blue cost plans are unique in that they allow you a lot of nice flexibility. For example, if you just want to take the medical portion of a Platinum Blue plan, you can do that, and you can get a separate, independently working Part D drug plan. Or if you'd like the simplicity and the convenience of adding the medical and the drug together, combining those into one package solution, you can also do that. Now, these Platinum Blue plans are one of those plans I referred to earlier as being regional. And that means the county you live in is going to dictate whether or not you're eligible to enroll in one of these Platinum Blue cost plans. Now, the federal government has identified 21 counties in Minnesota where we can offer these Platinum Blue cost plans. Now, again, that's not a Blue Cross decision. That's the federal government telling us where we can offer these plans. So let's start there, and let's go over to the maps on this screen to the right. That top map of Minnesota is going to highlight the 21 counties where these Platinum Blue cost plans are allowed to be offered. So you do indeed need to reside in one of those highlighted 21 counties in order to be eligible to enroll in the Platinum Blue plans. However, as you'll notice that map of Minnesota right below, your network, the doctors that you can go see, that's going to be statewide and include 97% of all providers in the state. So you have a very large statewide network. Now, these Platinum Blue plans have low monthly premiums starting at just $29 a month. There are 3 different Platinum Blue options. And again, if you just want the medical portion of the Platinum Blue coverage, that's fine. But if you do want that convenience of adding the drug to the medical, we can combine that into one plan, giving you the convenience of having one card, one bill, a one package solution. The Platinum Blue plans are also going to provide a lot of nice extras like dental, vision, and hearing. Again, we do have that large statewide access. If you travel outside of Minnesota but within the U.S., we're going to extend coverage to all 50 states. And if you do travel outside the U.S., your emergency coverage will go with you. And finally, these are annual contract plans. and that just means every year the benefits can change. Well, speaking of changes, we have made some nice enhancements to our Platinum Blue plans, moving from last year 2020 into this year 2021. First of all, your out-of-pocket exposure on both the Choice and Complete plans has been reduced. So that has been taken down by $500 on the Choice and $1,300 on the Complete. Your Tier 1 preferred generic medications will have no copay, no cost to you for those medications. We are going to include some new benefits this year as well, such as over-the-counter allowances, and that would be for things like vitamins and supplements. We're also going to include a nice acupuncture benefit, and we're going to include preventive dental on both our Choice and Complete plan options. Well, not really changes to these Platinum Blue plans, but definitely key features to be aware of. Again, that large network access covering 97% of all the clinics in the state. We have over 60,000 pharmacies in network across the U.S., and no referrals are needed. And that's a really key feature, because if you want to get a second opinion or go see a specialist, you can just pick up the phone and make that appointment. No need to get a referral. If you are traveling outside of Minnesota, as I mentioned, and within the U.S., coverage does extend to all 50 states, and quite simply on these plans, you can go see anyone that takes Medicare. Now, if you do travel outside the U.S., your emergency benefit goes with you. And that's a great benefit to have, but I do recommend to all my Platinum Blue members, if you will be traveling outside of the country, to look at adding travel insurance. And at Blue Cross Blue Shield, we have a great travel insurance program called Geo Blue. Now, we won't have time to go into the details on how that Geo Blue program works, but know that we have it, and if you're interested, you can contact us. We'll be happy to get you more info. All right, well, here we have our 3 Platinum Blue options. We have the Core, the Choice, and the Complete. Now, the first monthly premiums we're going to look at are just for the medical portion of the plan. So on the Core plan, it's $29, the Choice $94, and on the Complete, that's $164. Now, if you did want, as an option, to add that drug plan coverage and bundle medical and drug together, on that Core plan, if you look down from the second line item from the top, you'll see the monthly premium to add the drug coverage would be $25.80. That combined with the $29 for the medical, you'd be at $54.80 a month. On the Choice plan, to add that optional drug coverage, it would be an additional $40.50, which would bring you to a total of $134.50. And finally, on the Complete, it would be an additional $66.30 to add that optional drug coverage, and that would bring you to $230.30. Now, there is no deductible for any of your medical coverage, and we do have an out-of-pocket max. And this is really important because, remember, this is what original Part A and Part B Medicare do not offer. So on that Core plan, in addition to the $29 a month you pay to have the plan, the most you could spend on covered benefit costs in a calendar year would be $6,000. If you got to that point, you are now done. Now Blue Cross is going to pay 100% of all your covered benefit costs. On the Choice plan, that out-of-pocket exposure goes down to $3,500, and on the Complete, we take that down to $2,700. All right, well, on this next slide, we're going to look at medical benefits. So you have a medical benefit category listed over in that column to your left, and then you're going to simply slide over to the right to see what kind of out-of-pocket costs you would have to take advantage of those specific benefits. So first of all, primary care visits on the Core plan, $20
The next plans we're going to be talking about today are the
Medicare
supplements,
Complete,
what are
no
commonly
cost
referred to as
if you're seeing a
Medigap
specialist, like say
Now,
a
with these
dermatologist
plans,
or an orthopedic
Medicare
doctor,
is actually
on
your
the Core plan,
primary
you can see
insurance.
You pay 20%
That
of
means
the cost.
all administration
on the
of
Choice,
benefits
you would
and
have
all
a
claims
$15 copay,
start at
and
the
again, on the
Medicare
Complete,
level.
no
Now,
cost.
Medicare is going to pay on those
Now, on all
claims
the
based
plans,
on
your
the lab
benefits we
services
looked
are
at
going
a
to be
little
covered
earlier in
in
the
full.
presentation. If you do need
Then
a
the claim is
diagnostic
going to work
kind of
its way
test
to
like
us
an
at the
X-ray,
insurance company,
an
and we're gonna
MRI,
fill the
CT
gaps.
scan, or
Now,
radiology,
these
you would
Medicare
pay
supplement
20%
plans
of the
can
cost on the
only
Core,
be medical
whereas on the
coverage.
Choice and Complete
Some of the
plans,
other
those
plans we've
diagnostic
looked at
tests
today,
are
you
covered
can
in full,
combine
no
medical
cost to
and
you.
drug into one plan. Not the
Ambulatory
case here.
surgical
These
centers are going to be
only
places
medical
where you
plans.
go for
So if
same-day
you want to have,
surgery.
say, a drug plan,
Now,
you have to
ambulatory
purchase
surgical
a
centers are
separate,
not connected to the
independent
hospital.
drug
They're
plan.
either their own
These
freestanding building,
Medicare
or they
supplements
might
or
be
Medigap
in a
plans are
clinic,
also going to
and you
have
can
some other
see
unique
for those
features that set
same-day
them apart.
surgeries and
Let's
examples
take a
of
look
those
at
would be
that
like
next.
cataract surgery.
So first of all,
or
the
maybe carpal
benefits
tunnel
on these
you pay a
Medigap
percentage
plans
of the
are
cost for that on the
guaranteed to
core.
renew.
On the
That
choice
simply
of
means as
$50
long as you
copay,
pay
and
your
on the
monthly
complete,
premium,
that would be covered
you're
in
going to
full.
keep the same benefits
Now,
year
if
to
you're
year.
in the hospital,
other plans we've talked about today
classified as
have
an annual
outpatient,
contract, so those benefits
that
can
same day
change. Not
type
the
of
case on
surgery.
these Medicaps. And you can see it's the exact
Guarantee
same
issue.
copays
This
and
is gonna be a really
coinsurance
important
for those
concept
outpatient
for you to
hospital
understand.
surgery visits.
How
is
this
what it-
works
is what
is
it
you
is with
get
the
6
ambulatory
months
surgical center.
from whenever your Part B
If
is
you
in
are
Bravo
in the
Medicare
hospital
starts
and
to
categorized
enroll in a
as an
Medigap plan
inpatient,
and have
well, then on
a
the core
guarantee
plan,
issue,
you would have a
that means
$600
you fill out
copay,
the
and that would cover the
application
entire
and
time you're in the
plan.
hospital.
Now, if you
on the
enroll
choice plan,
after
that would go
that
down to
6-month
$200,
period,
and on the
then there
complete,
will be
it would just be a
health questions that
$100
go
with the
copay, and again,
application,
that would
which
cover
means
all
our
the days that you
underwriters
were
are going
in
to
the
get
hospital.
involved. They're going to look at any
Emergency and
pre-existing
urgent care, you
conditions,
can
and
see
they
there's
do have the
copays
right to
associated
deny
with those
you coverage.
services.
And finally, we finish
always
up
like
on
to
this
tell
slide
folks,
with
especially
Part
when
B
they're new
is
to
in Bravo
Medicare,
medication.
the best time
Now,
to
remember, the
enroll
most
in one
common
of these
example of a
Medicare
Part B
supplement
drug would
plans
be chemo.
is when you're first
On the
eligible,
core and the
because
choice plan,
that
you're
may
going to pay
be
the
20% of the
that you're going
cost
to have
for those Part B
guarantee
drug
issue.
administrations.
Now,
And
these
that would be
plans
up
are not
to
regional.
the
They are
out-of-pocket
available
max
to
we
all
looked at on the
Minnesota
last slide.
residents. And these
On the
plans are
complete
also
plan,
completely
it says
portable,
between
meaning
0
wherever you
and
go,
20%,
the plan
and
goes
it's really
with
gonna
you.
be either or.
Even
You're either
if
gonna
you
pay
move
nothing
outside
for
of
those Part B
Minnesota
drugs
and have
or you're gonna
residency
pay
in another
20%
state
of the
permanently,
cost.
these plans will
Now,
still
if you're
go
having
with
a
you.
Part B drug
Again, these are
administered
medical
to you
coverage
in a
only,
clinic
and that does
or a
give you the
hospital
ability
setting,
to then
which
choose
is
any
typically how those
standalone
drugs
drug
are
plan
administered.
available.
Then
to
you will
in
pay
Minnesota.
nothing.
If, however, you take
The
home
network for these
and
plans
self-administer
is going
a
to be
Part B
anyone
drug,
that takes
that's where you'll be
Medicare, and that's
responsible
not just
for
in
that
Minnesota, but
20%.
that's going to be across the whole country.
So you have a very
well, if you do
large
decide to add that
nationwide
optional drug
network.
plan, let's
If
look
you
at
do
how that
travel
works.
outside the
so
country,
first of all
your
drug plans
emergency
are going to
coverage
have
will
a
go with you.
formulary. Now, a
These
formulary
plans,
is
like
just
all
a
the others
list
we've
of
talked
the
about
drugs that
today,
the plan
come with
covers.
silver sneakers. That
All
great
drugs
gym
covered by
membership.
the plan are going to be
We also do
categorized
offer
by
local
tier
customer
levels.
service,
And
and
these
these Platinum Blue
24-hour
plans
day,
have
7-day-a-week
different
nurse
tier
line.
levels of
Blue
medication.
365
The first
is a
two
great
tier levels
program
are
that offers
primarily going to be your
discounts
generic
on
drugs,
health-related
tiers 3 and
items. These
4,
might be
you're gonna
things
getting
like
in your
glasses
brand name
or hearing aids.
medications.
And
And
we
finally,
do also
tier
offer
5
wellness
those are going to be your
programs
specialty
and health
drugs.
coaching to
Now,
all
on the
of our
core
Medicare
plan, you'll have a
supplement members.
$445 deductible to
All
meet
right, well,
before
here we
you
have
get
the
into
3
cost
Medicare
sharing with
supplement
Blue
or
Cross.
Medigap
On the
plan
choice and
options,
complete
the high
plans,
deductible
there will be
plan,
no deductible
plan
for tier
N
1
and
or tier
basic
2 drugs.
Medicare Blue.
If it is tier 3
Now,
through
you'll
5,
notice first with
that
the premiums, there's
$445
two different
deductible will
premiums.
apply.
The first one, tobacco-free.
Each of the
is
plans you
you're
can
not a
also
tobacco
notice
user.
has 2 columns
The second,
underneath them,
standard
preferred pharmacy
premium
and
is gonna
standard
apply to
pharmacy,
anyone
and that's
who
referring
used
to tobacco in
pharmacy
the
type.
last 24
So all
months.
those
So a little bit higher
60,000
premium if
pharmacies
you
that
are
we
a
cover
tobacco
across
user.
the country are either preferred
The high
or
deductible
standard.
plan, $70
Now,
and
examples
70
of
cents
preferred
a month.
pharmacies,
That's
the
tobacco-free
tobacco-free
CVS's,
and then you do
Target's,
have a deductible
Cub,
that's set at
Costco, Sam's Club,
$2,370.
Walmart,
So on this plan, you would
Thrifty White,
simply
just
be
to name a
responsible
few.
for the
Your
first
big standard pharmacy, that's going to
$2,370
be
in any
Walgreens.
covered benefit cost.
Now, Walgreens and other
If you
standard
get to the point of
pharmacies
meeting
are
that
going to
deductible,
be covered.
now you're done.
But you
Now
can
Blue
see you're
Cross
going
is
to
gonna
have a
step in
higher
and pay
copay for the
100% of
same
your covered
medication at a
benefit
standard
cost.
pharmacy.
As
Plan N,
opposed to
this
a
one works like a
preferred pharmacy.
copay plan.
Now, your tobacco-free
although
rate
drug
here monthly
plans
is
are always
$198
by insurance companies,
Medicare
and before
actually
you get to the
sets forth the
copays,
rules
you do
that
have
these
to
drug plans
satisfy
need to
Medicare's
follow.
Part B
And one of those
deductible,
rules is called
which
the
remember
coverage
applies
gap,
to
or what
any
you'll
services
commonly
you
hear
get
referred
outside
to
the
as
hospital.
the donut
And that's
hole.
$203.
Now, again, the numbers I'm about
After
to
you
talk
satisfy
about
that
are going to
deductible,
apply
there's
to
3
every
benefit
drug plan
areas
in
where
the
you would
country.
have copays.
So here's
and
how
I'll
this
show
works.
those to you
Once
on the next
what
slide.
you have spent on your
And
medication,
then finally we have what
and
of
what
these
the
three
insurance
plans
company is
amounts to the
subsidized.
most
When those two
popular.
numbers
The
together
basic
reach
Medicare
$4,130,
This one is $231. You are in the coverage a month. That
And on
means
this
now,
plan, just like
instead
that
of paying
plan
according
N,
to that
you
cost
will be
sharing
responsible
responsible for
for
satisfying
now
that
you're going
Part
to pay
B
25% of the
deductible of cost for all covered
but on the
medication.
basic Blue plan,
And you'll continue to pay that
25%
as
until
long as it's a
you
Medicare
and
eligible
you alone have
service
spent on your
there will
drugs
be
reaches
no further cost to you.
$6,550. If you get to
On the
that
next
point,
slide, we
you
talk
have now
about
reached what's
specific
called
benefit
catastrophic
categories,
coverage.
but we've really
now you're going to pay
explained how these plans work.
$3.70
And I
for
wanna go
coverage
through that
generics,
one more time.
$9.20
On the high deductible
for covered
plan,
brand
you are
name
simply
drugs,
responsible
or
for the first
$5% of the cost of your medication,
$2,370,
whichever number is
in any
greater.
covered benefit
And you'll
cost.
continue to pay
Once you
according
get to
to that
that point and
catastrophic
satisfy the
coverage
deductible,
schedule
there will be no
until
further
the
cost
end of
for
the
Medicare
calendar
eligible
year,
services.
at which point the
Plan
slate is
and the
wiped
copay
clean,
plan.
and
Remember, you do
start
have to
over.
meet that $203
Now,
Part
if this
B
is beginning to
deductible.
sound a
After
little
you do,
complicated, believe
three
me,
areas
you're
where
not
you'll have
alone.
copays.
But there is
Those
a
would
way
be
to
for
cut
office
through this and
visits
make it
at
a lot
$20,
easier to look
emergency
at how
room
your
visits
specific
50,
medications
and
will
finally
be covered,
urgent care,
and that's by
$20.
running what's called a drug calculator.
And then finally on basic
we have those
Medicare
calculators
Blue,
available
again, you're
on our
responsible
Blue
for
Cross
meeting that
website.
$203
working with
Part
an
B
agent,
deductible.
they
After
can
you
help
do,
you through that. No
as well.
further cost for Medicare eligible services.
Well, next, let's look at some
Now,
of
I
the
do wanna
extras that these
talk in
platinum
more
blue
detail
plans
are
about
going
the
to
second
offer.
line item
We've
from
talked
the
about
top where it
medical,
talks
drug.
about preventive
We're also going to have,
benefits.
again, some nice
And you'll
extras.
notice, so first of
Under
all,
the high deductible
over
plan,
the
and it
counter
says
items,
not
we're going to
covered.
give our members
Well, keep in mind,
$25
with these
every
Med
quarter
Gap, these
for
Medicare
over-the-counter
supplement
items, and
plans
these would be
things,
Medicare
again, like
is your
vitamins,
primary insurance.
supplements, maybe
So if
Band-Aids
it's a
or bandages.
service
Medicare does
Silver
not cover.
Sneakers
For the
is a
most part,
great benefit.
then
All
these
of our
plans
plans
will
are going to
not
cover
cover
it
it
either.
either.
How that works
Now,
is
at the
whatever
beginning
Blue
of the
Cross Blue
presentation,
Shield
we
plan
talked
you
about some
decide to
preventive
enroll in,
services.
the
Medicare
monthly
does not
premium
cover.
you
For
pay to
example,
have
an
that
eye
plan
exam
is
or
going to
hearing
cover a
screening.
gym membership.
So because
in
Medicare
full,
doesn't cover
as
those,
long
the
as
high
that
deductible
gym
plan
plan participates with
does
Silver
not
Sneakers.
as well.
Now, there are
Now, the
currently
basic
over
Medicare Blue plan
16,000
is actually going to
participating
give you
Silver Sneakers gyms
$120
across
every
the
year
country
towards
you can
those
join any
preventive
one of them.
services,
And there is no
Medicare does
limit
not
to the
cover.
number
So
of
now you've got
gyms
that
that you can become a member
$120
of.
to use, for
So
example,
if you like to use the
towards an eye
YMCA
exam
pool
or
in the
hearing
morning,
screening.
and then maybe go to a Lifetime Fitness to work out in
All
the
right, well,
afternoon,
that's everything on the
perfectly
supplements.
fine. Those are pretty
There is no
straightforward plans.
minimum number
We
of
will
days
move
you need to
next
go to the gym
into
to
the
maintain
Medicare
this
Blue
benefit.
Rx standalone
Silver Sneakers
drug
also
plans.
has developed
Now remember,
some
a
great
lot of the
home
plans
workout
we talked
programs you
about
can take
today
advantage
come
of as
with
well.
drug coverage. But if you have that
Acupuncture, this is a new
Medigap plan
benefit this
option we
year.
just talked about.
Medicare
there
is
is
actually
no
going to
drug
cover
coverage, so you
20
want to look
visits
at one of
for
our
acupuncture, but it has to be
standalone drug
related
plan
to back
options.
pain.
So you're going
And
to get
those would
that.
be the standard
But you're
plan
also
at
going to get from the
$66
Platinum Blue
and
plan an
40 cents a
additional
month,
20
or the Premier
acupuncture
plan at
visits
$104
for any other
and
70
pain.
cents a month. Physical
Now, on the
exams are
standard
going to be
plan,
covered in
there
full
will be
on
no
all the
Platinum
deductible
Blue
for Tier
plans,
1
no
or
cost
Tier
to you,
2
and this is going to
medications.
go above and
If you do
beyond
have
that
a
kind
Tier
of
3
fringe
through
and
5
wellness check that
medication,
Medicare offers.
you will be
So
responsible
all
for
our
the first
Platinum Blue
4
members get that full annual physical
and over on the
covered in
Premier
full.
plan, we got rid of
On our
that
Choice and
deductible
Complete plans,
altogether.
we are gonna
Remember, we
offer
do have a
preventive
formulary,
dental,
which
which means you
each
get
plan
2 and they're all
exams,
different,
2 cleanings,
and
a set
on
of
the
X-rays,
formulary, all the
and
drugs
a
that we cover
periodontal
on these
cleaning
plans
every
will be
year.
classified by those 5
The Choice
tier
and Complete
levels.
plans are
The
also
first
going to
2
extend
being
two
primarily
vision exams to
generic
our
drugs
members
at no
Tiers
cost
3
every
and
year,
4 being
with some nice
primarily brand name
reimbursements
drugs
on
and Tier
eyewear.
5
And
specialty.
finally, we will also
Same
give all of our
preferred and
Platinum Blue
standard
members a
pharmacies
hearing
is what I
exam
talked
covered
about
at no
earlier.
cost,
So again,
with some
examples
nice
there,
discounts
preferred
on
pharmacies.
hearing aids.
You've got your CVS's, Targets, Walmart, Cub, Costco, Sam's Club, just to name a few of those. And the big standard pharmacy on these plans would be Walgreens. Again, Walgreens or any other standard pharmacy is covered, but you pay a little bit more for the same medication at one of those standard pharmacies as opposed to going to a preferred pharmacy. Well, that coverage gap or donut hole that I discussed earlier with those other plans, that still does apply as it does to all drug plans in the country. I won't go through those details specifically, but I will point out that our Premier plan, that one that's just over $104 a month, has a slight exception to how the coverage works when in the coverage gap. So on that Premier plan, if you do indeed get into the coverage gap, any of your Tier 1 and Tier 2 medications filled at a preferred pharmacy will be at no cost to you, as opposed to having to pay 25% of the cost like you would on any of the other plans that we looked at today. Now, whether or not that Premier plan is going to be suitable for your needs, well, we can run that drug calculator that I mentioned, and that'll help us determine which plan is going to make most sense for you. The Part D late enrollment penalty. So if you do not enroll in a Part D drug plan when you are first eligible, and then later down the road decide to pick one up, Medicare is going to penalize you. Now the penalty is going to be 1% of the national average cost of a prescription drug plan. That's around $50 a month. So 1% of $50 is 50 cents, and then you're going to multiply that by the number of months you could have had a drug plan, but you didn't. Now, whatever that calculates out to be, you're going to be paying every month on top of the cost of whatever drug plan you enroll in. And you'll always be paying that penalty every month as long as you have a Part D drug plan. Now, if you never take a Part D drug plan, you'll never have to worry about the penalty. But I always like to advise people that is out there. A lot of folks new to Medicare, especially if they're not taking any medications or maybe very inexpensive medications, might wonder, why should I take a Part D drug plan? And this would be one answer to that, to avoid the penalty down the road. So just be aware it's out there. Well, medications can be very expensive, and I want you to know there is extra help to pay for the cost of medications. To find out if you qualify for any of this extra help, you can either contact Social Security or Medicare, and I have those phone numbers listed for you on this slide. Well, that basically brings us to the end of the content I wanted to cover with you today. I do have 3 more slides that Medicare requires I show to you. What to expect when you enroll. You're going to get a welcome letter, a welcome packet, and an ID card, and I can go into far more detail with you if you do decide to take a Blue Cross Blue Shield plan. The next couple slides, again, just give you more important information. Remember, if you'd like a copy of these PowerPoint slides, I'd be more than happy to send these out to you.
Thank you for tuning into the Medicare Workshop video. I hope it was helpful and informative. When you have questions, don't hesitate to reach out to us. We're here to help. One last reminder, if you know anyone who is turning 65 or about to retire, you're welcome to share our contact information or invite them to attend a Medicare workshop like this one. Thanks again, and take care.